Well, I hope you enjoyed your lunches, and we're really delighted to be here. I'm Dan Kass. I'm the Senior Vice President at Vital Strategies for Environmental, Climate, and Urban Health. I'm so excited today to introduce you to two mayors who we'll be speaking with. To my right is Mayor Chilando Chitangala from Lusaka, Zambia, and hopefully, oh, there you are remotely, Mayor Kostas Bakoyannis of Athens, Greece. So a quick round of applause for them. So these mayors are part of a network of 70 cities that we call the Partnership for Healthy Cities, a 5-year-old initiative where each of the mayors that are part of this network has committed to do something about non-communicable diseases and injuries, something fundamental in the city that changes a policy which can be demonstrated and hopefully scaled to really help solve a critical problem of their choosing. For example, cities are working to address cancer, heart disease, and other sort of leading causes of illness through changes in streetscapes, reducing vehicular speeds, addressing the quality of food in public institutions. These kinds of initiatives are really making a difference. In 2019, we had to pivot this program a bit, and we expanded it to include supporting a COVID response. And each of the mayors in this network was able to do quite a bit around COVID. And so we're going to hear today about some of the work and the lessons learned from the mayor of Lusaka and from Athens about COVID and its impact on public health in their cities. As you know, more than 80% of all preventable deaths that occur in the world are from chronic diseases, from non-communicable diseases. And it's really critical that cities be positioned to address this problem. That was the goal of the initiative, and we had an opportunity to, we'll have an opportunity to hear a bit more about that. I also wanted to draw your attention to the fact that sometime, I think today, there'll be an article appearing in The Guardian that'll highlight some of the initiatives that are part of the Partnership for Healthy Cities Network. So I'm going to begin with a first question to you, Mayor Chilando. No doubt there were really critical lessons that were learned from your experience with COVID-19. I wonder if you could comment on how, as mayor, COVID-19 has influenced your own thinking about public health, and on how you think public health can go forward even post-pandemic.
Thank you. Thank you very much, and good afternoon, everyone. Thank you for having me. 2019, 2020, I think for us it was 2020, and at that time I was not mayor, because I became mayor like a year ago. So I was the chairperson of public health, so it meant that I was one of the frontliners to do a lot of sensitization and just go into the communities to make sure that they understand what is going on. From the part of Africa that we're coming from, that I'm coming from, our first case was like in March 2020, but it took us some time to convince people and make them understand that it's really here. Yeah, because everybody was saying, no, we don't travel, so we're okay. But no, it's not about traveling. It's here, you already have the first cases, so we have to start. So sensitization in communities was number one. Yeah, and then also we had to make sure that we had partners. So partnership was also very, very important. And then as a local authority, there is no way that we would have managed just on our own. So we had to partner with central government, which was Ministry of Health. Yeah, Ministry of Health, and also other partners, like the way we partnered with Vital Strategies on making sure that our sensitization, which Vital Strategies, of course, had to help us fund. Our sensitization in our communities reached the people by not just going out there to educate them, but also by making sure that the children that now stayed out of school for that time. By the way, we couldn't really do a complete lockdown because our economy would not allow that. We come from an economy where you had to keep running. So we were not like other countries that had to have lockdown or shut down completely. We couldn't have managed. People wanted that done, but leadership would not allow it. And I understood from the point that leadership was coming from. But we did have to close some schools. most of the schools, especially where we had boarding schools, stayed, but day schools had to close. And then that meant that kids stayed away from school. But when they started opening slowly, we had partnerships that would help us do a lot of sensitization in schools as well, making sure that they have their water, they have hand sanitizer, they have their masks. And obviously we couldn't have afforded the disposable masks, so we had to use reusable masks. So we had to now call upon people from all directions to come up with initiatives of sewing cotton masks and then teaching our children how to wash them and reuse them. So all that was only possible because we had a lot of partners. And then partners like Vital Strategies also. I remember one of the things that I liked very much was when we had cartoon comics for the children, just to teach them that, by looking at the book and seeing all those nice cartoons, they would learn that this is how you wash your hands, this is what you do, and COVID is here. So we had such initiatives. And apart from that, in our markets, very crowded markets, we had talking walls, they call them, talking walls, where you had to draw up and just remind people how to stay away, keep away, and practice healthy protocols. Yeah, all the 5 protocols that were there, you draw them on the talking walls, we call them. And we have 38 wards. So Lusaka is divided in 38 wards. So each ward had to have like 2 talking walls. So that was very good partnership. But then at the same time, without government coming on board and helping us through, we would not have managed. And then civic leadership also was very important in that, because for us, you will not stay home. You need to go out there and tell the people exactly what is happening. And our people listen more to actually civic leadership, because we usually use a bottom-up approach where you talk to the people, do a lot of sensitization, and then you take it up. So it meant that a person like I would have to go to the community and really convince them, like, look, these people are not just dying from alcohol abuse or malaria, which is common. Actually, we have COVID with us. So, and in Africa, if you don't go for a funeral, then you're not mourning with the people. So we had to go out there. By the way, my city is 70% informal. So it means that the other 70% is just houses very close to each other. And then if you don't go for a funeral, it's like, they're not, the person is not with us. So you have to explain to them, you don't have to do this now. There's no more. When somebody dies in the house, please don't go anywhere near. This is the toll-free number you have to call. Yeah. So there was a lot of sensitization that had to go on. But as a council, we also introduced what we called green schools, a partnership where we have like 58 schools in the district that we had to make sure that we do a lot of sensitization and also make sure that they follow the protocols, which is washing hands and so on. But then our partners now had to buy us wash basins. We had to get the masks and so on. Then businesses had to close down. So that became a very big problem, where businesses, and these are small businesses, barbershops, saloons, and of course, the people that sell drinks, so it meant that they had to close, and then no business for them. But for that, we had help from UNDP, United Nations Development Plan, who started giving us a bit of social capital. Yeah, social cash transfer, a bit of capital for the people that had closed down the businesses, because now it meant that they went on for a very long time without opening. But we had to control the hours as well. So we used to follow what South Africa used to do, because it was next door, and they had a bigger crisis than us. So when they closed their bars and their work premises, or just maybe they allowed 2 to 3 hours of work, we would also do that after we see what is happening. But it meant that people lost a lot of money. But today, the outcome is that because now we are open, there's a lot of illegalities for people trying to get money from lost time.
Yeah. I mean, it's interesting. I'm hearing you describe what some people call a whole of government response. So there was an infrastructure response to it. Communications was really critical. You involved sort of schools and all of the other institutional arms of government to really address this. I want to, and finally, I think the emphasis on the role of partnership. I mean, the Partnership for Healthy Cities, after all, is a partnership of its own with the cities, with Bloomberg Philanthropies, with the World Health Organization. So, you know, it's nice that it's sort of emulated at the city level as well. Let me turn to Mayor Bakoyannis and ask you the same really question, like what has been the impact of COVID on how you frame public health as a mayor, and what do you think will be the sort of longer-term consequences of it for your own thinking about promoting public health?
Well, let me begin by thanking you so much for the invitation. I'm very sorry that I couldn't be there in person. Flashback to 2020. I don't think that any of us actually expected that we would have to come to terms with a pandemic such as COVID. The truth is that most of us were unprepared. And the truth is, the sad truth, is that most of us had to work at the time of crisis, in a crisis mode, taking each moment as it came, without having the opportunity back then to actually indulge, let's say, in long-term planning. So, having said that, however, COVID did, I think, define our thinking. Number one, we learned to put politics and partisanship aside, actually focus on data, on real analysis, on vigorous discourse. And number two, we were able to build, let's say, quote-unquote, competitive advantage of local government. Local government is all about what's happening on the sidewalk. It's about working bottom-up rather than top. Which meant that focus on the most vulnerable communities. Those are usually left behind. At the time, around the world actually advised to stay at home. Many Athenians, however, didn't have home. So practically, in a very short period of time, created a shelter, able to house up to 400 Athenians, conditions of dignity. The good news, I'm happy to report that this center, which is actually one of the biggest in Europe, is still functioning. It was actually singled out by the World Health Organization as a best practice. At the same time, we covered black hole in our city, because what we didn't have was a shelter, homeless drug addicts who were forced to the streets. Now they were given a new structure to be able to regain an opportunity to life. And about 2.5 to 3 years, over 100 of those people have actually moved forward, being able to liberate themselves from this curse. At the same time, we invested heavily in Help at Home, which is a program designed. The idea was that we didn't want anyone people who are elderly, who are living alone in their apartments, to feel insecure or to feel threatened. So practically, they would call someone at the street. One of our people would come on their door. It could be something as simple as from a supermarket, or it could be the need to have a coffee test. It could be a medical injection, whatever. We would be there for them. And we also strengthened our social work, is what we call it, of the city. These are actually people, groups, teams of social workers, doctors, who literally walk around the city and try to help people who are sleeping on the streets. In this, we are grateful with vital programs on naloxone. Naloxone, for those of you who do not know, is literally life-saving medicine for opium overdose. Now it's been legalized in Greece. We actually fought hard for that, but we were able to pay the government, and we feel that we can be much more optimistic about the future.
Thank you for that. I'm struck by the way in which prior efforts by the city, especially with regard to the unhoused population that you're describing, sort of enabled a better COVID response. What else, I know as part of your participation in the Partnership for Healthy Cities, this continues to be a population that you're really emphasizing. Just very briefly, can you talk a little bit about what else you want to be doing in this population?
But here's what's actually quite interesting. The Chinese say that a crisis is both a blessing and a curse. In our case, COVID was clearly also a blessing because we were able to move forward with these shelters during COVID. These shelters didn't exist before. So basically, in a very short period of time, working under the stress of a crisis, we were able to actually cover, let's say, gaps, the social solidarity net of our city. And now we are building these newfound institutions as we're trying to bounce back, but actually to bounce forward, which means that we're trying to constantly enrich the services that we offer. And of course, at the end of the day, it's about lessening the number who are sleeping rough in the city. They are half right now than what they were 3 years ago. I don't know whether it's realistic to actually talk about zero this number. I think it's pretty ambitious. But it's realistic to plan and actually bring the number down to 100, 120 by 2025.
Thank you for that. And then you have the last question. In the minute remaining, I wonder if you could also talk a little bit about your intended activity in the Partnership for Healthy Cities that isn't COVID related.
Okay. First of all, we've been working with Vita Strategies on safety for the children. Yeah, road safety for the children, because about 3,500 deaths in the whole country, 37% of that happens in my city. And for the local authority, one of the things that we've done is really concentrated on the safety of these children. So about 70%, which is okay, maybe about 65% of the children go to school on their own. Some use public transport, but then others walk. So from the distance where they drop off from the public transport to their school, it's a walking distance. So we have to make sure that that distance covered is safe for them. So we have the paved way, and then make sure that the pedestrian crossing is painted, and then you have humps. So we've worked with Vita Strategies on 2 public schools where we did that, and the outcome has been very, very good. And we want to continue because it's important that we safeguard the lives of the small children, especially the ones who are 16 and below, because those are the ones that are very prone and very vulnerable to such kind of traffic accidents. Yeah. So my office is working with Healthy Cities, and I'm hoping that they can come back and help me more to achieve this in the city.
Well, thank you both for your leadership and your inspiration and helping your cities get through COVID. And we look forward to continuing to work with you. So thanks, everyone.
Thank you.